We're joined with Mark Taylor, registered compounding pharmacist, and we're talking about what compounding medicine has done for men who suffer from erectile dysfunction. Through you and compounding medicine, you've brought a lot of hope to them. Tell us about it.
We have. Everybody's very familiar with the commercials on TV for Viagra, Cialis, Levitra. Those are great products, but they don't work for everybody, and also they have side effects, and some men can't tolerate that. If that is the case, we do have some medicines we can use that'll help them. Most of these men have gone to their family physician. Now they've had to escalate that to a urologist, and urologists will usually work with us in providing a medicine and a proper dosage that will give these men relief.
And you always say it's combination medicine?
It's either a single medicine or a combination of medicines to get the proper result.
Wonderful. Men Finding Hope with Mark Taylor at Jersey Shore Pharmacy. We're joined with Mark Taylor, registered compounding pharmacist, and compounding medicine has really brought some hope to women who have gone either through menopause or as they get older, they lose their sexual desire. And many times it's because they physically have changed and they need medical attention. So what have you come up with and what do you do to help with these solutions?
Well, there's nothing really commercially available out there for this problem. So what we do is we work directly with their physician, usually their OBGYN. To find out what the issue is. It could be hormonal, it could be lack of sensation, it could be a lot of different problems.
And so you then work with them to find out this. I mean, is it usually on one try, or do you have to go back and forth and try and keep working with the woman and the doctor?
It can be as easy as one try, but sometimes it's not, and if it's not, there are other alternatives.
Wonderful. Bringing solutions to women. Jersey Shore Pharmacy. We've all suffered from pain of a shoulder or elbow at one point or another. Joining us is Mark Taylor, registered compounding pharmacist, to talk about alternatives to taking a pain pill.
Right. There are. We very commonly do what they call a chronic pain cream. There's a lot of people out there either have very physical jobs, maybe they're injured in an auto accident or some other type of injury, and they suffer from pain. Instead of taking a narcotic or a muscle relaxant where it makes them drowsy, groggy, they can't work, we can actually make a pain cream that's applied topically right to the site. And the advantages of it are it's a lower dose, less side effects, and it's applied right to the site, so it works right at your elbow, at your shoulder, your knee, whatever it happens to be.
And the possibility of addictions is reduced as well.
Exactly.
Thinking.
If you're not taking something that's addictive, then you're not going to have an addiction.
I think that's wonderful. So many of us go through pain. Mark Taylor from Jersey Shore Pharmacy. We're joined with Mark Taylor, compounding pharmacist, and Dr. Ernst here at the Cape May County Zoo. And giraffes, as we're standing in front of beautiful giraffes, they either cannot or will not swallow a pill to take their medicine. So how do you counterbalance that? How do you handle that? And how does Mark help you?
Hoofstock species like giraffe are prey animals, so they have evolved defenses to help survive in the wild. Things like very thick skin, which makes giving them traditional medications through an injection very difficult. So I have to use darts to get medication to them, and I need to have a very concentrated drug to fit into a small dart.
And we come in, we're making this medicine concentrated. These animals have a high level of adrenaline, which counteracts the medicine. So they need a solution of injectable is very, very concentrated so that it works.
So it's really the beauty of compounding medicine?
That's the beauty of compounding, is we can adapt to any problem.
For animals or humans?
Correct.
Awesome. Thanks so much. We're joined with compounding pharmacist Mark Taylor and Dr. Ernst. We're here at the Cape May County Zoo. And Dr. Ernst, you've mentioned to me that compounding medicine really is a must for you as a veterinarian here at the zoo.
Because I work with such a wide range of animals, from things as small as frogs to animals as large as our giraffe, and things in between like our silver fox kit, Bryn, we have very specific needs when we have a medication. So I need to have a good relationship with a compounding pharmacist so that when something goes on, I can call them and they can formulate something for me that fits the need of that specific species of animal.
Unfortunately, manufacturers have a one-size-all approach, meaning one pill will treat everybody, and that doesn't work for humans, it doesn't work for household pets, and it definitely doesn't work for animals here at the zoo. So we're able to reformulate that medicine and treat something as small as a mouse up to the size of an elephant and make it into an injectable form, a suspension form, a suppository form, or whatever Dr. Ernst needs.
Awesome. Thanks so much. pharmacist Mark Taylor and Dr. Ernst here at the Cape May County Zoo. And Mark, compounding medicine is about taking medicine and changing its form, but you're not just, some crazy scientist just putting stuff together.
Right, we're not just sitting in a back room throwing some powders together. There is an art to it, there's a science to it, there's testing involved. We need to be able to make something that's very accurate and very sterile.
And now we're here in front of Rocky, the giant tiger. So I'm imagining medicine is important for you to do your job.
Yeah, at near 500 pounds, we want to make sure before we examine Rocky that he's sedate and and that he stays sedate for a long period of time. So in order to accomplish that, we need to give him a large concentration of drug because he's such a big animal. And we have such a small volume to get it into a dart when we dart him. So we need to have concentrated drug to do that.
So we have sterile and an accurate dose. And now I'm thinking and concentration.
And also we changed the form to be a very concentrated medicine.
Awesome. We're joined with compounding pharmacist Mark Taylor and Cape May County Zoo veterinarian Dr. Ernst. And animals here at the zoo, they're safe. They live much longer than they would in the wild, which brings a whole new level of issues for you.
Yeah, animals in captivity live longer than their wild counterparts. So one of the challenges here is treating geriatric issues that you normally wouldn't see in the wild. For instance, Brutu is a 14-year-old lion here at the zoo, and he has arthritis in his elbow. So one of our challenges is trying to get enough arthritis medication into him to make him feel better.
And that's where Mark comes in.
Yeah, Brutu is a larger version of your household cat, and like any other animal, they have issues with flavor and taste. So our job is to make sure they like their medicine.
So they can take it so that they're stress-free.
Exactly.
Yeah, since we started the medication that Mark makes for us from Jersey Shore Pharmacy, Brew is much more comfortable. He walks around a lot more, and he's just a happier animal.
Awesome. Thanks so much. We're joined with compounding pharmacist Mark Taylor and Dr. Ernst here at the Cape May County Zoo, and we are in front of the lemurs. Now, they're really, really cute, but they're very smart. How does this create challenges for you?
Yeah, primates like our troop of ringtail lemurs here have very acute senses of taste and smell, so they can very easily detect anything that's different about their food. So one of the challenges when we try to medicate these guys is trying to hide it in the food without them detecting it. And if they do detect it, it could put them off totally, and then they won't eat any food or drink anything for a little while after that.
Or trust you at all.
That's right.
And Jersey Shore Pharmacy comes in to work with Dr. Ernst to medicate the animals. We'll incorporate the medicine with a certain flavor, maybe a sweetener, and that'll decrease the bitterness of the medication and make sure they don't detect it.
And I'm thinking then that reduces their stress and everyone's happy.
Yeah, as long as we stick with the routine and they don't detect anything different, then everyone's happy.
Wonderful. Thanks so much. Joined with compounding pharmacist Mark Taylor and Dr. Ernst here at the Cape May County Zoo. And breeding endangered species is a big initiative of the zoos.
Yes, it is, Adrian. Our pair of snow leopards for the third consecutive year have produced cubs, and they are amongst the most productive snow leopard pair in the entire country.
And this was part of some help from Mark at Jersey Shore, correct?
Yes, it was.
Yeah, the male snow leopard has glaucoma, so our job was to come up with a formulation that was flavored, it would taste good, so we could treat his eye pressure and makes him much more happy.
And when he's happy, I'm thinking that's what you want to keep this genetic match going.
He feels better now. He has less pain. When he has less pain, he has less stress. And when he has less stress, he's happy and breeds.
And that's ultimately what we like because breeding in captivity is difficult.
Indeed it is.
So Jersey Shore is helping with endangered species here at the Cape May County Zoo. We're joined with Mark Taylor from Jersey Shore Pharmacy. Mark Taylor is a compounding pharmacist. Right. You have to get a prescription from a doctor. So you work with the doctor, but you take it one step further with the doctor when a patient is in need. So explain that dynamic that you and the doctor do when something's not working for a patient.
Was a lot of different circumstances as to why somebody would need compounded medicines. For instance, if there was, say, a manufactured medicine that came in two different strengths, one strength was too high, one strength was too low, we needed something in the middle, we would be able to compound that medicine for the right strength for that particular person.
Is it the same medicine?
Same medicine, we would make it the correct strength, and we do a lot of testing on our products to make sure they are accurate and that what we say they are, they are.
So I'm thinking, just because something's not working doesn't mean you're at the end of your road.
No, there's many options. Like you said, we can work with the doctor and go back and forth until we get the problem solved.
All right, thanks so much. We're joined with Mark Taylor from Jersey Shore Pharmacy. Mark is a compounding pharmacist. Compounding medicine really speaks to the person who's in the situation where they have to swallow a pill or administer medicine to an animal for a long period of time, and for some reason they just can't handle that medicine.
Right.
So tell us some of the things that you can do to make that situation easier.
Well, the options are endless. Real common examples would be a human being that can't swallow a tablet. We can make it into a liquid form. An animal, same thing, it can't swallow a tablet, make it into a liquid form.
I'm holding this up in your shot, and you click this, as you said, this is 1 dose per click.
Right, this would be for a cat, and a lot of cat medicines can be applied to the ear and get absorbed through the skin, so it's very easy for the owner. They make a couple twists, they apply it to the ear, and voila, the medicine's inside the cat.
And the mean, angry cat doesn't know the difference, and medicine is getting administered.
Correct.
Mark Taylor, the problem solver.